Good morning and a warm welcome to all. It's an honour to have the Minister Jones, colleagues, partners and guests with us today. I'm Stephen Beckwith, the proud Executive Director of the South East Toronto Family Health Team, and we want to start our day by acknowledging the land that we're all here on today. And I would like to ask Dr. Brendan Kelly to do our land acknowledgement. Brendan.
Thank you. We acknowledge that the sacred land on which we serve our community is on traditional territories of the Wendat, the Haudenosaunee, the Anishinaabe, and the Mississauga of the Credit. This territory is covered by the Dish with the One Spoon Wampum Belt Covenant, an agreement between the allied nations to peacefully share and care for the lands around the Great Lakes. We recognize the many Indigenous people who presently live on this land known as Turtle Island, as well as their ancestors. We further recognize that the contributions and historic importance of Indigenous people must be clearly and overtly connected to our collective commitment to the Truth and Reconciliation Commission of Canada calls to action, real in our communities and in our work. The Southeast Toronto Family Health Team will remain committed to advancing Indigenous sovereignty in the work that we do, knowing that this is not a single action, but an intentional journey. Thank you.
Thank you, Brendan. And for those of you who don't know, Brendan is completing his second year of his residency here, and we're thrilled to be joining our team permanently in the fall of this year. I do want to take a moment to acknowledge that today is Administrative Professionals Day, and like many healthcare facilities nationwide, we can only function with our superstar administrative staff. Some of them are here today. So please join me in thanking the administrative staff for being the backbone of healthcare across this country today and every day, and they deserve the recognition for their hard work and dedication. We are one of many primary care groups across the province that offers team-based care and are highly committed to providing exceptional care to our community. As a teaching site for the University of Toronto Department of Community and Family Medicine, we're always happy to teach and mentor future clinical professionals. And we started our journey here at 840 Coxwell and expanded to the Carswell Health Centre in 2012 on the Danforth. Building on the success of our first two sites, we expanded to a community site in 2022, working in collaboration with valued community partners in the high-needs neighbourhood of Taylor, Massey. With the support of the Ministry of Health, we've been able to reach out to more people and provide team-based care in priority areas across the East End. The team at the newest site works closely with our partners, including Woodgreen, Michael Garron Hospital, and our Ontario Health Team, East Toronto Health Partners, and East Toronto Family Practice Network, to provide an integrated care model to ensure that we provide the best possible care to our community. With all this success, we still face specific challenges as primary care is under pressure regarding fair compensation and staff retention. Physicians are an integral part of our work, in addition to our interdisciplinary team, but they have faced increasing operational administrative burdens post-pandemic. With the continued support from the Ministry of Health, we hope to alleviate these pressures across the primary care teams. We take pride in the fact that it truly does take a team to provide primary care in every evolving world. And we are grateful for the advocacy of many of our guests here today and the continued support from the Ministry of Health, which helps us to continue our mission of providing exceptional care to our community in the East End of Toronto. And without further ado, I'm pleased to introduce the Honourable Deputy Premier and Minister of Health, Sylvia Jones.
Thank you and good morning, everyone. I appreciate, Stephen, your entire team at the Southeast Toronto Family Health Team for hosting us today and for everything you do to connect patients and families to the care they need in their communities. I also want to recognize some of the many partners joining us today from the Ontario Medical Association and the Ontario College of Family Physicians, Ontario MD, and eHealth for their partnerships as we work to make it easier for family doctors to put patients before paperwork. Under the leadership of Premier Ford, our government has been making record investments in healthcare. And through our Your Health Plan, we are continuing to take bold and innovative action to build a better connected healthcare system that provides Ontarians with a better health experience at every stage of their journey. Since 2018, our government has added over 12,500 new physicians to our workforce, and we are continuing to build on that progress. We have launched the largest expansion of the medical school education system in over 15 years, adding hundreds of new undergraduate and residency seats across Ontario. while breaking down barriers for internationally and interprovincially educated healthcare workers to make it easier and faster to work right here in Ontario. Through our government's 2024 budget, Building a Better Ontario, we are connecting more Ontarians to primary care. We are investing $546 million to connect 600,000 more people to primary care through new and expanded interprofessional primary care teams. Building on our historic investment we made earlier this year to create and expand 78 primary care teams, and building a new medical school at York University, the first medical school in Canada that will focus on training family docs. Today, I am pleased to announce that our government is continuing to make it easier to connect to the care you need by making changes that will enable family doctors and other primary care providers to spend more time with their patients and less time filling out paperwork. Our government is launching an innovative program called AI Scribe to provide for more than 150 primary care providers that safely uses artificial intelligence to automatically summarize or transcribe conversations with patients who consent into electronic medical notes. We will also be making changes to prohibit employees from requiring a sick note for a worker's job-protected sick leave and encouraging them to use tools such as attestations that maintain accountability as employees request time off when they are sick. As part of our government's Patients Before Paperwork initiative, we have already taken action to axe the facts, to speed up diagnosis, referrals, and treatments. We've expanded e-services to digitize more referral and consultation forms so that they can be conveniently shared electronically, and to improve the e-form platform to make it more convenient for providers to autofill and share forms, freeing up as much as 95,000 hours per year. Expand the implementation of central intake models through the centralized waitlist management program, and work with the Ontario Medical Association to streamline and simplify key medical forms. Together, these changes put patients before paperwork, allowing clinicians to spend more time with their patients, resulting in a more connected and convenient patient care experience. Under the leadership of Premier Ford, we are getting it done. Thank you again to all of our partners for your leadership to making it easier for physicians and patients to connect with the services they need. And for everyone, all of you who provide Ontarians with the right care in the right place every single day. I will now pass it on to the President of the ONA, Dr. Andrew Park, to share a few words. Stay well.
Good morning, everyone, and thank you to the Southeast Toronto Family Health Team for welcoming us here this morning. My name is Dr. Andrew Park, and I'm the President of the Ontario Medical Association. On behalf of Ontario's 43,000 doctors, thank you for the opportunity to appear here today. In October, we released our prescription for Ontario Doctor Solutions for Immediate Action, which included 11 recommendations to address 3 key areas that require immediate attention. The first is fixing primary care, the primary care crisis in Ontario to ensure that every Ontarian has access to a family doctor. Currently, 2.3 million Ontarians do not have a family doctor, and that's 2.3 million too many. The second is to reduce the mountain of administrative burden that physicians face every day. Doctors are spending almost as much of their time in front of computers as they are in front of their patients. This is clearly inappropriate and must be fixed. And lastly, addressing hospital overcrowding by increasing community care capacity. Last month, we were encouraged to see some of these solutions reflected in the latest provincial budget, including $546 million for new primary care teams and $2 billion for home care. Today, we welcome progress on our recommendations around reducing administrative burden. The burden of unnecessary administration takes up an alarming 19 hours a week of physicians' time, keeping them from either patient visits or a healthy work-life balance, or in most cases, both. We estimate that 4 of these hours alone are spent on sick notes and government forms that doctors are asked to fill out every single day. This is why we are encouraged with the steps being announced today by the Minister. We are pleased that the province will move forward to prohibit employers under certain circumstances from obtaining a sick note from their physician. Over time, we would like to see sick notes eliminated completely. This is practical, as physicians cannot diagnose illness after the fact, and it saves workers both time and money. We also welcome new funding for the innovative artificial intelligence scribe pilot project. AI is a new frontier with great potential to reduce administrative burden, but we need to test this technology. So we thank the Minister for funding Ontario MD, an OMA subsidiary, and its partner to launch this innovative pilot project on AI scribes. Over the past year, we have worked with the government to address system-level issues that create unnecessary administrative work. For example, we are working to reduce 12 government forms ranked as the highest priority for our members. We hope that today's announcement will give us the momentum needed to either eliminate, streamline, or digitize these forms in a manner that is fully integrated with a physician's EMR. Is there more work to be done? Absolutely. But tackling 19 hours per week of administrative burden will require a multi-pronged approach, and this is a step in the right direction. Once again, I would like to thank the Minister for making the reduction of administrative burden for physicians a priority. We look forward to working with you and your ministry every step of the way to make progress for the benefits of all Ontario. Thank you.
Hi, everyone, and thank you for having us today. I'm Dr. Pyle Agarwal, and I'm a family doctor and innovation fellow at Women's College Hospital. I want to thank Minister Jones for this announcement and the support that the government has given to the evaluation of the AI scribe technology. I am a family doctor, and as you have heard this morning, the administrative burden associated with being a primary care doctor has grown. This takes away the time that I and my colleagues have to care for our patients. The AI Scribe digital tool is a great example of how artificial technology can solve some of the administrative burden facing primary care. If any of you have been to your family doctor recently, you remember that unfortunately the visit is often interrupted by the family doctor having to face their computer to type in notes. This multitasking is challenging and takes away from the time that I and my colleagues want to give to our patients. AI scribes are an exciting new technology that listen to the conversations that I am having with my patient and organizes the information into a high-quality clinical note that I can review, edit, and use in my chart. And this means that with patient consent, instead of focusing on documentation, I can focus on them, listening to their concerns and addressing their problems. I am excited to be part of the team that is working with Ontario MD, Women's College Hospital, and the E-Centre of Excellence to do a clinically focused evaluation of this new technology. Today, we have family doctors and nurse practitioners across the province trialing this technology to determine the impact it can have for our clinicians and patients. We are also working to evaluate the privacy considerations of each tools to ensure that personal health information is managed safely. Thank you again, Minister, and we look forward to sharing with you the results of our work soon.
Of the Southeast Toronto Family Health Team. I've been working here at this Family Health Team for about 20 years almost. As a host here today, I want to thank all participants for coming to our FIT and showing such tremendous support to family physicians in primary care, the glue that keeps our province's healthcare system together. I'm very grateful for the support pledged today. It feels right, and it feels good to have our struggles recognized. Specifically about today's announcements, which are hot off the press and which I'm just digesting, I can certainly see how the introduction of AI scribes will decrease the amount of after-hours paperwork that I face and increase connection with patients during the encounter. The decrease in the sick notes is also very exciting. Not only will that decrease paperwork burden, but also it contributes to equity of patients. There are many who don't have family doctors and who are not able to get those important work notes to get paid. This commitment of support announced today is a welcome step in the right direction, as are plans to increase medical school spots that are underway and funding to increase team-based care, such as was recently announced in locations like Peterborough and Sault Ste. Marie, just to name a few. But we shall not rest on our laurels as community practitioners, as more needs to be done. We are all aware of the grim statistics, as Dr. Park mentioned, 2.3 million Ontarians without family practice right now. That number is supposed to double within the next 2 to 3 years. Residency match numbers are showing a decreased interest in choosing family medicine as a career, and we will all be watching carefully tomorrow as the second iteration match day takes place. I suggest a necessary next step is updating the family practice payment model to allow office-based care to keep up with inflation and to compensate physicians for the many unpaid administrative tasks. This is not a grandiose goal. We only have to look to our neighbours in British Columbia, whose revamp of their compensation model done a year ago has resulted in an increase in 700 physician spots, more active family physicians than they've seen in a decade, and almost a 20% increase in active family doctors. We need to show our graduates that family medicine is a viable career option. We need them to see, beyond today's announcements, ongoing change in how the government supports family practitioners in the community. Daunting, but not an impossible task with continued commitment of the stakeholders I see here today, I believe the goal of connecting all Ontarians to primary care is achievable. And I would like to just thank all of my colleagues, my staff, the interprofessional team I've been working with for all the hard work that you do in East Toronto. Thank you.
All right, we'll now take questions from the media. As a friendly reminder, the format is one question and one follow-up. Please state your name and your outlet before your question.
Hi, Minister Jeff Gray, Globe and Mail. Welcome to my family doctor's office. Great work they do here, taking care of my kids. I might make an appointment after if someone's there. I wanted to ask, just building on the announcement today, I mean, it sounds like you're addressing the paperwork question that continually comes up. But the warnings from the medical groups and the medical schools that we had in our paper this morning about, and it was alluded to there in those comments, the challenge to attract people to become family doctors, the compensation model, the amount that other kinds of doctors can make. Are you looking at bigger changes? What else have you got in the hopper to try and address that bigger problem? Because, I mean, AI, scribes, and sick notes are important, but it's not going to fix this.
So I am not able to speak to an ongoing negotiation that is happening between the Ministry of Health and the OMA on the Physician Services Agreement. So I will set that piece aside. We do have a standing committee with the Ontario Medical Association to deal with the paperwork piece. Look, we know that when physicians have the opportunity to do less paperwork, they often have the ability to see more patients. We want to ensure that the changes that we are making, like the scribe piece, will make it easier for family physicians to choose that particular specialty. Now, specifically in terms of what else are we doing, in the budget, of course, we spoke about and announced York Medical School. That will be the first medical school in Canada that focuses over 60% of their students going through will have a primary care focus. And when we make those types of changes, when we expand residency positions in all of our existing School of Medicine, of course, including in Northern Ontario, we have highlighted and set aside seats and available positions for individuals who want to study and stay in family medicine. We're making the investments on the education piece. We're having the conversations and making the investments on what can we do right now to make it easier for family physicians to practice and be in front of their patients. We will need to study the model to make sure that it works for both the physicians and the patients, but initial anecdotal information suggests that it's going very well.
While I've got you here, on the private or community surgical clinics, as you refer to them, we haven't heard much about that. Is that process on time, on schedule? There's supposed to be hips and knees happening by the end of the year in these clinics. Can you say anything about how many clinics, with there RFPs going out, how many operations do you expect to have happening in those clinics?
So we're actually today having an initial conversation to show how individuals and organizations and clinicians can apply to become an integrated community surgical and diagnostic center. The regulatory piece has been finished, and now we're having the conversations about what it actually looks like to make those applications. And I will tell you that while, of course, we have no applications currently, there is a lot of interest and excitement out in our communities to see how they can improve access to publicly funded healthcare services, whether that is through diagnostic or, of course, with surgeries as well.
Hi, good morning. Jessica Smith-Cross from the Trillium. I'll start by following up on Jeff's question there in your response. You mentioned conversations about the Bill 60. Who are those conversations with today, and what do they entail?
So we actually have a webinar. Individuals and organizations, clinicians who are interested have signed up for the webinar, and the webinar will go over the details of what we are looking for, what the expectations are, what the application process will look like.
And on today's announcement, can you clarify when sick notes will still be allowed, and tell us why you didn't ban them entirely as the OMA would have liked to see?
So the sick note announcement that we have made today is individuals have access to 3 sick days over the course of a year, and the need or the suggesting that an employer can ask for sick days has been removed.
Next question.
Hi, Minister. Barbara with Queen's Park Briefing. I wanted to ask about the Public Health Ontario labs. There are 6 that are set up for closure. Have you made any decisions about that yet?
So what you are referencing is something that the Auditor General brought forward in a value for audit and value for money audit. And I have been very clear in my answers in the chamber. We have not had any kind of proposal, but I have no intention, and our government has no intention of limiting and removing access to well water testing in the province of Ontario.
But is your minister not considering any changes to the provincial
We haven't had
well
any
water?
proposals. So to suggest that we are considering changes, we have no proposal brought forward. I want to be very clear. Well water testing is a really important piece that we have with our public health units, specifically and very focused in rural Ontario, and that will continue because we know the value and importance of it. Thank you.
I'm Minister Mark McAllister from City News. Just over a year ago, your government had a program that's since been discontinued that offered health care to people who are undocumented, uninsured in this province. Since then, obviously, there have been people that have been in need of emergency care, have been in need of major surgeries, that have been receiving bills for tens of thousands of dollars from those health care providers. What can you do at this point to offer that health care to those people?
So let's clarify some things. If you need emergency surgery in the province of Ontario, you will get it, and you will not be charged in an Ontario hospital. We have community health centres that are funded very specifically for individuals who are undocumented refugees, and that work continues. You are talking about a program that we put in place during COVID when people could not and were unable to travel back to their home community. That program ended when the travel restrictions under COVID ended. Thank you.
At that time, you also received letters from organizations like the Ontario Medical Association, like the nurses, saying this is a program that is going to help and should be continued at that point. Is it something that you'd reconsider?
We have existing programs within community health centres that are funded very specifically for certain underserved populations. That work continues. As I said, emergency surgery in the province of Ontario at an Ontario hospital will be funded, and individuals and patients are looked after. That work continues.
This will be the last question.
Good morning, Minister. Tina McKenzie, CBC News. In light of the CBC reporting around concerns how Ontario's MedChecks program is being used, we learned the government has been auditing some of the Shoppers Drug Mart medications reviews and clawing back funds. How many Shopper Drug Mart locations have been audited, and how much money has the government taken back?
Listen, I think it's very important for us to be clear on all the programs that we put in place in the province of Ontario, pharmacy being one example, 19 minor ailments. We are constantly monitoring, assessing those programs to ensure that they actually provide the services that we want when we initiate them. You know, we're talking about scribe opportunities here. We will make an assessment based on the impact that we see from both the clinicians and the patients to ensure that the program is making the impact that it does. And we do that with all programs. You know, our pharmacy partners have been a great partner for ensuring vaccine rollouts, for ensuring people continued to have increased access through 19 minor ailments, where individuals, instead of having to go to an emergency department or a family doc, could get assistance at their local pharmacy. And we assess those programs to ensure that the intention is actually making an impact for patients and for the system as a whole. And we'll continue to do that with all programs, including MedCheck.
Okay, follow-up. Some, including the Ontario Pharmacists Association, want to see changes to the program so it's more streamlined and to ensure it's used appropriately. These changes include less paperwork for pharmacists and doctors, and changing the eligibility criteria for 3 medications to 5. Will your government make changes to this program?
So we're working very actively with the Pharmacy Association and their boards to make sure that the program that we have in place, that has been in place for, I think, since the 90s, continues to bring value to the patient and to ensure that we are most appropriately reaching those more challenging patients who are on multiple medications. I will say again, all of the programs that we put in place in the province of Ontario through the Ministry of Health, we are assessing to ensure that they are giving us that value, both at a clinician and a patient side, and we'll continue to do that work. We'll tweak when it's appropriate, but to ensure that the programs actually are providing the necessary oversight for patient safety. Thank you.
All right, that concludes our media availability. If I could get the podium party to stay up for a couple of photos, that would be great. Thank you, everyone.